there's this opioid crisis happening right now in the States, and I'm not actually familiar with it so much so in Europe here, but I mean, as kind of the VR work that you guys do touches on kind of the benefits towards, you know, dealing with pain, maybe you could kind of set the stage a little bit and discuss for maybe some of the listeners that don't know so much about or aren't so familiar with the opioid crisis, which I think might be a good context for some of the work that you guys do.
Certainly. So the background is that in the US, but really globally, there has been an over-reliance on drugs for dealing with pain. And kind of the summary of that story is that there was a lot of, there used to be a very integrated view of pain, that pain is something not just physical, but also mental. And through a number of changes in healthcare and some lawsuits and all sorts of ugly things, it became, we gradually slid down this pathway to, you know, there was a fear of untreated pain. And so gradually doctors, they didn't want to be, you know, accused of or be liable for untreating pain. So they started giving more drugs and more drugs and more drugs. And eventually this integrated idea of body and mind and attitude and psychology fell by the wayside in the United States. And so it ended up that doctors were just, so all these integrated pain programs vanished. And then doctors were just giving drugs. So the natural outcome is that a lot of people were taking too many drugs. The thing about opioids is that they're generally effective. And if you're taking opioids just for a short amount of time and you can get off of them, you have a tooth extracted, or you have some sort of procedure and you can get off of them, that's fine. But 10%, about 10% of the population is really susceptible to addiction. And also, when procedures don't really work, when someone has an accident or someone has a condition that you know, doesn't really go well, particularly, they can end up with a cycle of overuse. So for a number of reasons, either genetic predisposition or kind of the condition that they're in, a lot of people ended up using way too many drugs, leading to overdoses, leading to addiction, leading to a lot of pharmaceuticals out in society that have been misused for other uses. So that's kind of the backdrop. Enter VR. So I've been involved in VR pain relief for a long time. And it kind of started, the genesis was at the HIT lab at the University of Washington, but the early uses were all studies with pain for changing bandages, wound care for burn patients. Burns are the worst. They're the most painful thing I think you can have. We're talking about people who have really extensive burns, 60, 70% of their body burned, returning from the battlefield and things like that. What you find is that VR really helps people through these procedures. They can get a lot of benefit. The nurses can move faster. They're not, you know, if you're wearing a headset, you're not staring at the nurse changing your bandage and freaking out about that. So it reduces anxiety, it speeds the procedures, lots of benefits. And also we found that they need less drugs when they're going through these procedures. So for acute care, where you're just trying to help somebody through a procedure, it can be really beneficial. The long-term, the addiction, the long-term problems are really about changing, you know, chronic conditions. And so we've also been working on chronic pain with biosensors and using different kinds of approaches and physical therapy and things like that. So using VR as a way to help people overcome long-term chronic conditions. And then doctors are finding that it actually can help people get off of opioids and change that addictive cycle.